Assalamu alaikum. Ultrascan Diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest is the bone and its evaluation around each implant. On the 3D rendering, you can very clearly see that we've got very good bone support on the lower implants, and we've got good bone support in the upper right, but we've got relatively less bone support in the upper left segment. This is the panoramic view. We're going to show you the axial view first, which is the top to bottom view. Now, axial view will show you this is the upper arch, this is the maxilla. And on the maxilla, you will be very clearly able to see that this is the crest of the bone region. And here you can see that you've got slight bone loss crestally around the upper right central. The upper right K9 region implant is doing very well. The upper left central incisor region, as you can see, has a little bit of bone loss, and that because of its, we won't say bone loss, but we will say it is definitely placed more facially, so we've got a little bit of facial bone loss. But no peri-implantitis can be seen. As we move further inferiorly, the upper right implants are dead center of the ridge, whereas the upper left is slightly towards the buccal aspect. Now we're going to show you the transaxial view after this. This is the axial view of the lower implants. The lower implants have good bone support. You've got cortical bone support, no peri-implantitis, no crestal bone loss, and you can see that all the implants are situated and placed right in the center of the ridge. If you move towards the transaxial view, the transaxial view is basically the proximal view. So here you can see this is the upper left K9 region implant. We've got cortical bone here. On the buccal aspect, we've got cancellous and cortical bone support. And you can see that the implant has bone all the way to the crest here. Moving to the upper lateral incisor region, this implant again has a very thin cortical plate present here. We've got cortical bone support. On the parietal aspect, you can see that we've got bone here and here. Very little bone on the buccal aspect, but again, you can see that there is definitely bone support present. This is the upper left central incisor implant, and here you will be able to see that we've got because of this positioning and because of the thickness of the ridge, you've got little cortical support here. There we go. So you've got little cortical support here, but other than that, this implant does not show any signs of peri-implantitis. Moving to the lower implants now. The lower implants, this is the K9 region implant. There we go. This is where the crown is situated subcrestally, actually. So here you can very clearly see that the implants are doing well. There's good bone support. This is the implant in the lateral incisor region. There we go. Good bone support, no peri-implantitis. This is the implant in the central incisor region. Again, good bone support, buccally and lingually. This is the implant on the lateral incisor region, and then the implant on the left side. So this is the distal most implant on the left. There we go. So we've got overall very good bone support. This is what a good cortical support on the buccal and on the lingual looks like, because then this results in less insignificant bone loss with time to go. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.